If you have pelvic floor dysfunction, one of the muscles that are heavily forgotten are your adductors. So let me explain to you a little bit more about that. Stay tuned. Hey, this is Dr. Shakib from Core Pelvic Floor Therapy right here in Irvine, Orange County. When it comes to pelvic floor dysfunction, a lot of times people are just so confused, maybe not so much confused, but they're so focused on the internal work that goes with pelvic floor dysfunction that they forget about all the external things. It just doesn't make sense to let go of the external factors when it's the external factors that directly influence the integrity of the pelvis that pelvic floor is the floor of. One of the muscles that are heavily engaged with pelvic floor dysfunction are your adductors. Your adductors are the muscles on the inner thigh that get connected to your pubic bone area. So if you have tight adductors, it can be close to the private areas, or it could be the sections close to your knees that are compromised. Either way, the whole length of the muscle need to be addressed, need to be worked on. And one of the things that we do in the practice is doing what is referred to as ART, or active release technique, for the adductors to get rid of those knots, the tension, and get them more involved in proper movement of the pelvis and the hip joints. They are heavily important with the health of the pelvic floor and pelvic floor dysfunction, and you should consider mobility of your hip joints when you have pelvic floor dysfunction. Hope that this helped. If you are not following us on social media, use one of the methods of contact in the description box to reach us there. I actually think we do have the stuff in the description box that you can just check and see where to find us on social media. If you're not subscribed to the channel, do so now, and until next time, take care.